Unity Immunity Lectures. I'm one of your moderators, Lauren Brown, the founder of Healthy Seminars, and a big thank you to the other two moderators today, Sandro Grassa and Lorianne Slough, working both in the front and behind the scenes to make these lectures appear and become smooth. I do want to let you know about our lecture today and a few other things that are happening in our world. So I'm going to bring up the Healthy Seminars page and let you know that if you go to our resources, so here you can see there's resources on my screen. If you go to that, that'll take you to the resource page. This is where we're constantly putting in our community lectures. And these lectures during the week tend to be free, Monday to Friday. And on the weekends, they tend to be more paid lectures, CEU approved lectures. And when you have one like today, so we have Eating for Fertility by Marlene Merritt. This one actually is a Throwback Thursday lecture. So this is the Integrative Fertility Symposium lecture Marlene Merritt gave in 2016. So we're doing a replay, and Marlene's here. So post your questions, because here we're doing this in April 2021. Marlene, you'll listen to the 2016 lecture, and then Marlene, at the end, will do your Q&A and provide any updates. So after these lectures, these free live webinars that are community lectures, we put them into our community library, and they're available then by subscription. So if I can see if I have a tab open for that. So this is the community library, and in the community library, we take these live webinar recordings and we put them into our library. So we're up to 189 now. Over the past 10 years, this is where they are, and it's available for a very minimal monthly fee. You can access all 189 of those lectures and growing. So all of these lectures that you see in our community library will show up there. We're also going to put any of the fertility ones that we're doing in April. We're going to have a few Throwback Thursdays and some new pop-up fertility lectures. These free live webinars, we're going to also include them in the Integrated Fertility Symposium registration fee. So if you go to the resource page, this tells you what's happening. This is for the month of April. If you scroll down, it tells you a little bit more what's happening. So for example, on Monday, we have Sean Goodman doing a Master Dong acupuncture talk on treating loss of smell for post-COVID-19 patients. So he's going to do a free lecture on that, and then it will end up in the community library, and you can access recording with your subscription to the library. We got also this month, Ross Rosen is going to talk about the narratives in diagnosis and treatment, storytelling, patient practical relationship based on that Shen-Hammer model. We got Sally Rappaport going to talk about using Chinese herbal medicine, the end of long hauler's dilemma with classical formulas. Also, these are all free live webinars that you can sign up. So if you scroll down, you'll keep seeing what we have going on. In April, we're starting Yvonne Farrell's mentorship. So that's still on sale, big savings, over $700 in savings. So check out our mentorship page, which you can find on the resource page. It will take you there. And if you scroll down, we also have the IFS. So the IFS this year is happening online. And I want to tell you a little bit of what's happening because we have a fertility topic. So you may be interested in fertility. If you want to go to the IFS or you want to register, I do want to let you know that we're using your Healthy Seminars accounts to register and log in. So basically, if you're logged in, you know how I can see my account, etc. We're logged in here. On the left, there are links to take you to the community library that I just mentioned, links to go to our mentorships that we have available, and then a link to the IFS. So if I click my link to the IFS, there's many ways to do it, but if I'm logged in, it will take me to the IFS website. And I'm just going to sign in, and I've already registered. And I just want to let you know what's happening with the IFS. It's online. There's up to 36 hours of continuing education CEUs you can earn. What we've done is they're available all on demand starting by May 1st. You're going to have 2 months to access them. So lots of lectures, lots of great lectures that we have here. They all open up. You can see what they're all about. We've created forums. So it's over 2 months, remember. So rather than just watch on demand, you have the opportunity to discuss lectures and case materials with each other. We have created a calendar because although they're already recorded, I got to watch these, we are going to do some live replays. So some of the lectures will have a replay where we're going to replay the recording where we come together as a community to watch together. And then at the end of the lecture, as you can see here on some of the weekends, the speaker will be there to interact and answer your questions. So scroll down, we have it in calendar format or line format. So basically what we've done is we created a conference that has a lot of content that's available throughout May and June for you to watch at your pace, as well as live replays, as well as we're going to have pop-up Q&A and panels during the week where the speakers will come together and just answer questions about their talks, or we'll have panels. The other thing we've done is we have created public educational videos. I should say your speakers. Many of our speakers are both dual trained. They're actually MD, OBGYN, IVF specialists, REIs, and they're TCM. Like, they've done both training, and they've created public educational videos on why seek out Chinese medicine naturopathy, why to do integration, why to do the preconception care based on clinical experience and research. And the goal is that you will share these videos on your website, on your social media, on Instagram, and this will inspire patients to come and see you. So after watching one of these speakers' lectures, you're going to get excited like I did, like, this is good content. And although you know how to do it in the clinic, you may not exactly know how to do it, how to explain it or articulate it like that professional, that other expert. And so now you know how to do it. You're excited about the material, and now you have a 10 to 15 minute clip that you can share and let your patients and the public know you can treat them like this. And it adds the credibility factor that they're IVF specialists telling patients why you want to do herbal medicine and acupuncture if you have infertility, if you have PCOS, if you have endometriosis, if you have recurrent pregnancy loss. So it's really about inspiring the public to come and see you. And that's all going to be included as part of your IFS. So that's the website. We'll start to drop some of the lectures actually even late April. Now, in person, those that have been to the IFS, I just want to let you know, to get 20 CUs, it used to be a little bit over $600 for those 20 CUs. You can earn up to 36 CUs, and the early bird is until April 25th, and it's only $350. If we put these courses all on Healthy, we charge on average $25 a CU. Eventually, it'll be $897 through Healthy Seminars individually, way down, but you can get all of them for $350, and you have access for May and June. And we've created lots of opportunities for you guys to connect with each other. I just want to let you know that's what that is going to be about, the Integrative Fertility Symposium. And you can get to that from this link here or from your account. You'll see the link on the left-hand side. Now let's talk about our lecturer and our speaker today. So our speaker is going to be Marlene Merritt. Again, this is from the IFS 2016, and she'll be here to answer Q&A. Marlene's trained in Chinese medicine, does a lot of functional medicine. She does have some lectures for CUs on Healthy Seminars. One is Nutrition, the Forgotten Pillars of Chinese Medicine, and another one is Mending the Mind, using nutrition, herbs, and lifestyle to reawaken the brain from dementia. So I will let you know that she'll be on to take those Q&As. Just a quick disclaimer, and then team bring up the recording. This is for educational purposes only. There's no CEUs provided for this free lecture. It's for educational. It's not meant to be medical advice. It should not be interpreted as medical advice. If you have a health condition, please seek out a healthcare provider. This is for entertainment and educational purposes only. I do hope I get to see many of you at the IFS online this year. Again, take advantage of that early bird rate, and stick around. Post your questions now in the chat room, and then after this lecture, Marlene's going to take your questions and maybe give us a little bit of an update. Let her roll, please.
So just a short, get some context about what I do. So after I got my DOM, a few years later, I got another master's in nutrition. And so what we do in our practice, all of our practitioners are acupuncturists, including myself. I still do acupuncture, but a lot also of what we do is functional medicine. So we really have our foot in both camps, and we can really speak both languages really fluently. My husband works with me too. He often lectures with me. Some of you have seen him. But we left him home today. He's in the hotel across the street. All right, so the learning objectives for today is we're going to discuss what you're looking for in terms of working with women who are trying to get pregnant, also to have an optimal pregnancy, and also to have the healthiest child possible. So the first place that we're going to start here is to define the issue of subclinical malnourishment or malnutrition. So this paper, which is the next slide actually, is talking about how maternal health and fetal outcome are clearly obviously related to nutrition and also to physiological stressors, which we're going to talk about. Those two out of those four is what we're going to talk about today, simply because these other two are huge topics as well. So the answer to this statement, the plausibility of micronutrient deficiencies being a significant contributing factor to the occurrence of pregnancy complications, absolutely. One of the good quotes here was, the evidence that preconception nutrition can influence the early embryo, coupled with the fact that a significant proportion of pregnancy complications occurred during the first month of pregnancy, argues that fortification and supplementation programs should be aimed at all women of childbearing potential. And so those of you who have seen me lecture before, you know that one of the reasons I went into nutrition is because most of the patients that we're working with have subclinical malnourishment. You know, they don't have scurvy, but they're not doing great, right? And so what we're looking at here is how can we actually optimize that? It doesn't necessarily have to be through supplementation, so I'm going to give you a bunch of options later on. The main deficiencies discussed in this paper were iron, folate, zinc, copper, selenium, and a whole bunch of different vitamins. So when we look at malnourishment, you know, the primary deficiency is like you just don't eat enough of that. And then you can have secondary deficiencies. So things like SNPs, you know, they talk about MTHFR and other mutant genes. You can have nutrient interactions. For those of you that are unfamiliar with fiber and phytate, both of those will prevent the absorption of bunches of different minerals. Like even to the degree that in a standard nutrition textbook, they will say, do not take your multivitamin if you're eating whole grains, because phytate will prevent the absorption of minerals. So micronutrient interaction. So zinc and copper, these are all like, you can look them up really easily. Zinc and copper always need to be in balance. If you do a lot of zinc, it's going to cause a copper deficiency. Iron and manganese run in the same biochemical pathways. Zinc and vitamin A also, so things like that. Diseases like diabetes and hypertension actually will cause malnourishment just because of the overload on the system. So the person is trying to physiologically manage huge amounts of sugar, for example, and they use up a huge amount of B vitamins. And then, of course, things like drugs and other things. So how do we get malnourished? Well, first is you eat cake. You know, when I saw the snacks earlier today, I was like, oh my God, the whole day, we've had sugar the whole day. So, but sugar causes malnourishment. Like it causes you to flush minerals out of your system, also utilize, like I just said, a bunch of different B vitamins. This also goes for carbohydrates. So sometimes we tell people like sugar's bad, but you go ahead and eat as many like carbohydrates as you want. That doesn't work either. Low-fat foods also cause malnourishment. You're going to see this come up again in a slide here, but there are such things as fat-soluble vitamins, and if you eat low-fat, you don't get those. Factory-fed animals do have a different nutritional profile than grass-fed. Beef is the classic example of that, or pasture-fed chickens. The egg quality is completely different than something that's pasture-fed. If you're vegan or vegetarian, you absolutely will have nutritional deficiencies. If you drink super clean water, so this is reverse osmosis, and that being said, I have reverse osmosis at home and at my office, but I add minerals to them. If you have very clean water like this, it pulls minerals out of your tissue and will cause mineral deficiencies. If you're eating conventional raised vegetables, so this picture is because conventionally raised vegetables often need to have pesticides because they're a bit weaker. And so, you know, when my husband says, you know, we can't digest rocks, so we have